Good afternoon, everybody. It is Wednesday, the 7th of June. You're here at Lunch and Learn. We're getting people unmuted. Richard's on vacation for a bit, so as if you haven't tuned in before now, Aaron's been doing a series of webinars on the NewMind software, and those have been recorded and they are being posted on the NewMind YouTube channel. So if you missed one, go ahead and check out the NewMind YouTube channel and you can listen to them. Today, the focus of his talk will be on Photic. And so, Aaron, everybody unmuted so far?
Yep, got everybody unmuted. And just so everyone knows, I did get the first webinar we did posted. Been a little busy with appointments, so I haven't had a chance to get the other two, but I'll have all of these will be up probably by end of day Friday. I'll send an email out on the listserv so everyone knows they're available. If you want to go back and rewatch them, or if somebody missed one, they'll be there for you.
All right, perfect. Well, here we go.
So, Photic entrainment. Hopefully everyone is aware that our 4 and 20 channel amplifiers are capable of powering Photic glasses. There is a port. If you've got one of the newer style amps, the black ones, there is a port on the back left side of the amplifier. If you've got one of the original white ones, those are up on the top, and it'll be labeled there Photic. If you don't have any Photic glasses, you can contact Jason and acquire a pair of those. We do stock the True White, which there are many colors that are available. Different colors can be utilized for different things. We stock True White because they don't have any emotional effect on our clients. It's just a way of getting the photic frequencies in to stimulate the brain without causing any change in emotional states. But they do have like the cool blue glasses that are blues designed to really calm somebody down. So if you've got somebody in a state of high anxiety, blue glasses can be used for that. Green, they've got green ones. Those are kind of middle of the road. They've got the calming effect of blue with a slight energizing effect of what yellow would have. There's also the kind of the next step up is orange, and orange has a mild stimulating effect to them. There are yellow glasses that both Dr. Suter and I would not recommend even having a pair in your clinic. Yellow is highly stimulating, and the problem that both Dr. Suter and I have seen over the years with yellow is that some of our clients come in with underlying anxiety or underlying sleep issues, and yellow can actually aggravate that. So somebody who naturally, they've never said they have anxiety or never had sleep issues, you've been training them for a while, and then all of a sudden you put some yellow glasses on them, and the next time you talk to them, they're making comments of that they were jittery after the session, or maybe they had a really bad night's sleep. So we tend to recommend staying away from the yellow. But if you want to introduce Photic and you want to do it on a budget, I would say just get a pair of the True White. That way you can get all of the effects that we're going to be talking about without any change in emotional states. So first of all, what is Photic? So Photic entrainment is using glasses. They've got small LEDs in them, and we're flashing those at specific brainwave frequencies. Some AVE, or audio-visual entrainment devices, also incorporate tones along with the Photic. So generally, that's going to be binaural beats. So you're going to have, in the headphones, what your client would be hearing is maybe if you're doing a 10 hertz through the Photic glasses, They may have like a 400 hertz frequency with a 410 hertz frequency, so you end up with a 10 hertz oscillation that you hear. That's that wah 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 effect. So you can stimulate them not only through the visual cortex but also through the auditory cortex. And NewMind Technologies combines both neurofeedback and entrainment in one technology. So that's in our 4-channel and our 20-channel amplifiers. So let's talk about how these glasses work. So the entrainment glasses flash lights at specific brainwave frequencies. We'll see that here in a little bit. In your NewMind software, we already have these photic frequencies pre-programmed, so you don't even have to think about it. So as the photic, the LEDs pulse, they're sending those frequencies down the optic nerve. The optic nerve responds and sends impulses to the thalamus. From there, it goes from the thalamus out into the visual cortex. So this picture here, we can kind of see those optic nerve pathways. I think this is a better image. So the visual pathways for the left and the right hemisphere respond with some independence to the light pulses. So the glasses have both a left and a right visual field. And we can see kind of how that right visual field here will cross over and we'll pick that up at the back of the, so we've got 2 receptors at the back of each eye. We've got one for the left or the right hemisphere here. That would be, or actually, yeah, this one's the right hemisphere, and that's always going to be the left visual field. So the left visual field activates the right hemisphere, right visual field activates the left hemisphere, and we can see kind of how that pathway travels down, terminating back at the occipital lobes. And just explains that there. The left visual field excites the right cortex, and the right visual field excites the left cortex. So the way this is done with our photic glasses is you'll notice that we've got 4 LEDs surrounding each eye. So we've got the 2 to the, what would be the right side of each eye is your left visual field, and then we've got 2 pulsing for the right visual field, activating the left hemisphere. You guys can ignore this. This is an old slide from years ago. Photosonics used to have a switch on their glasses. One was what they call peripheral vision, which kind of just flashed everything, all 4 LEDs around each eye at the same frequency. And the HM was hemistim. So those of you that I've known for years and years and years from another company, if you still have the Photic glasses from years ago, you may have this switch on your glasses. So anybody listening that does have an old pair of glasses from Photosonics, just make sure if they do have the switch, you just keep those in that HM position, or the hemistim is what they referred it as. That way you do get this frequency separation, which allows you to drive each hemisphere of the brain at its own specific frequencies. Here we can see kind of with a PET scan how Photic actually activates the brain. So we can see this whole activation at the back of the visual cortex. We can also see how it's lighting up the lateral geniculate nucleus. This is definitely something I want to spend a little time with. So we always have to keep in mind there's potential side effects to a lot of the things that we do. Even neurofeedback, we can get some sensitive clients that can have some weird reactions. It doesn't happen a lot, but can. But with Photic, first of all, let's make sure everyone's clear. If you have a client who has ever had a seizure, and that even means if it's only been one seizure and it was 30 years ago when they were a child, do not use Photic glasses with them. Even though they've been seizure-free for all these years, there is that potential that the flashing of the lights could potentially induce a seizure, even if they haven't had one in years. So just keep that in mind. Make sure if you're going to use Photic, you or your staff has talked to the client, and potentially even you've got something in informed consent, where they're signing that stating that they've never had a seizure disorder. Now, outside of seizures, about 1 in 40,000 people are photic sensitive. Some of them may know that. If they've ever sat around like a video game or even certain movies with flashing lights in it, they may have realized that they don't do well with that. So you can also ask that question, put it on an informed consent, or have it in an intake form. Check yes or no if you know you're photic sensitive. Most of your clients aren't going to know, the ones that are photic sensitive more than likely aren't going to know that they are. So just know that if you use Photic on your clients, I always recommend, if you don't generally stay in the room after you start a session, the first time you use Photic with somebody, I definitely would recommend hanging out in the room for maybe 5 or 10 minutes. Within that amount of time, you will know if your client's photic sensitive. So we see some things on the list here of potential side effects, such as visual hallucinations, dysphoria, agitation, insomnia, grogginess and confusion. Those are all known side effects, but generally what I've seen in my experience is in that first 5 to 10 minutes, if somebody is photic sensitive, generally what you hear is, I feel weird, I feel different, something doesn't feel right. You may hear them say that maybe they're feeling nauseous. Some people might start getting a headache right away. Feelings of being dizzy. So if you try Photic with your clients and you hear anything negative in that first 5 to 10 minutes, just simply turn off the Photic. So you can either do that in the software, which we'll see here in a minute, or you can simply just unplug the glasses from the amplifier, whatever is quicker and easier for you to get to at that point in time. Now at that point, with that client, you just won't be able to use Photic. Generally, the reactions to Photic will not go away. Like we know if we're training somebody at T3, T4, which is a sensitive area, and they get a reaction of that, we know we can just kind of move away to C3, C4 for a few sessions, and when we come back, generally that ab reaction they were getting training at T3, T4 will be gone. Unfortunately, with Photic, it's not like that. Once they're photic, once we find out that they're photic sensitive, they're going to have kind of a reaction every time we go back. So just keep that in mind. I've seen it's been kind of weird over the years. There are some clinics that I've worked with that it just seems like 50 to 60% of their clients are all photic sensitive for whatever reason. Other clinics, have used Photic for 10 plus years and they've never had a problem with it. So there's no rhyme or reason of who's going to have a reaction to Photic, but just keep that in mind that there are potential side effects. So you just want to kind of check people out beforehand. Now, the other thing we can kind of look at here is kind of how Photic activates somebody. So in this particular image, these maps are kind of more like a Loretta format, but what's going on here is we've got the first map here. So they were stimulating a 10 hertz alpha frequency through photic glasses. And here we can see this is without photic. So we can see alphas all kind of basically zeroed out within the norm range. And then they put photic glasses on, and we can see the difference there. And we got this big increase in 10 hertz. We actually got an increase in 9 hertz. Oddly, we also see our slow wave delta actually decreased in power. And that is one thing, and Dr. Suter is the master on this. So if you've got questions about kind of how photic plays around in the brain, he is the one to really kind of go over this. But it is known that, using certain frequencies in photic can actually cause a disentrainment of other frequency bands. Dr. Suter actually designed Photic for the 23 protocols, or 24, that the new mind map system generates. Hopefully, one of these years, we can talk about getting those put into our Zion unit, or maybe a separate unit that can be utilized with your clients, because I've seen them work magic. I've seen people use home audio, or the AVE systems at home without neurofeedback. And I've watched maps of kids where they initially presented with elevated delta and theta, and doing AVE for about a 6-month period every day, and this is without any neurofeedback, we actually saw a decrease of delta and theta power, over that course of time. So, Photic is pretty powerful just on its own. It's been around for decades. There's a lot of different devices out on the market utilizing it. And our Zion is one of those. Small portable unit. Can be great add-on. They actually, Dave Severs actually sells eyes open glasses that you can get. Our Zion comes with eyes closed, but you can get glasses that you can see through. So for those of you that have a lot of home trainers, if you have ever thought about potentially incorporating Photic for your home trainers, that's a great way of doing it. Of course, a lot of you that do our home training know that we don't have a port on the 2-channel amplifiers for Photic. So the Zion XL is a great way of adding Photic in for home trainers. And there's enough protocols in there to really kind of handle any protocol that we have. And then here is another map that we see here. So same kind of thing, we're putting in 10 hertz, and we can see that elevation, especially at the back, right, kind of where that photic's coming into the occipital lobes. We can see how that's affecting it. So let's take a look. Any questions? Feel free to jump in if you do. Interrupt me.
Hey, Aaron, I do. On
Sure.
the Zion unit, with it working with the Photic, does it also do any training through auditory? I'm asking because I have someone who has some sensitivity to lights. So she's not sure if she'd be able to use the glasses. Would it have any value with just the auditory part?
The Zion does have auditory with it.
Okay.
Of course, auditory is not going to be as powerful as what
Okay.
Photic would be, but they could still potentially get benefits just with the binaural beats alone.
Okay.
So that is something you could try out and see how they do.
Is that also the same for the Kasana unit?
Yes, those do have So almost every light and sound device out on the market is going to have some form of auditory.
Okay.
Now, most of them, if it's a device designed more for therapeutic use, most of the time that's going to be using binaural beats.
Okay.
There are companies producing AVE devices, more around the lines of kind of just relaxation. And you find some of those, they'll add in like nature soundtracks, instead of having binaural beats, just because
Hmm.
it's more pleasing to people to listen to babbling brooks and rainstorms and ocean sounds. I've noticed over the years for some people, binaural beats can get a little annoying. Just listening to, that kind of wobble effect for, 30 minutes or so. So you just kind of have to try it out with your clients. And if you are going to get a Zion or any device like this for a client, I would recommend having them try it out in the office, just so you can kind of watch them and see if there's going to be any reaction versus having them getting all the way home, trying it out, and then maybe going into a panic state, not knowing what to do. Keep them in a controlled environment and have them try it out. And there was one case years back. It was a gentleman and his wife who couldn't afford to do neurofeedback in an office, so they thought it would be the most cost-effective way would be to get a home Photic device. And the husband had actually had a seizure like 30 years prior. And I guess the seizure was actually, after going to a neurologist, they discovered that the seizure is actually caused by the olfactory senses. He was at a shopping center, him and his wife, and I guess a woman had passed by that had a fragrance on that, for whatever reason, too strong, whatever the fragrance was, he had a reaction to it, and actually had a seizure. So they were wanting to use the device, but my recommendation was probably not a good idea. That's about as far as I could go with it. And so what they ended up doing is he actually came into the clinic, and this was the clinical director asked me this question. They said, well, what if we do a trial run in the clinic? I said, well, that's up to you, of course. I would have him sign a waiver stating, that he understands there is the potential that he may have another seizure, and, that they're taking responsibility for that. But with that particular case, they did a 5-minute session. One day he came back the second day and they ran, I think, a 20-minute session on him, and he did fine. So I just wanted to kind of throw that in there, that I will always tell you no if you call and ask me. If somebody's had a seizure, you stay away from it. But if you had a client like that and you wanted to do a trial, same kind of thing. I always just recommend all of that be done in the office, just to make sure, if they have a reaction, somebody's there to take care of them.
Aaron, my
Yes.
2 cents on that. It might be also useful to send them, if there's a neurologist around who's willing to do an EEG and use photic. They sometimes do photic stim to perturb the brain and see if there's a reaction. So that might be a safe route.
Yes, definitely.
In screening people, I ask them questions like when I remember to, if they are bothered. It's usually in the winter when you're driving past trees and there's like the barcode on the road in front of them. If that bothers them, or if the sun flickering to the side of their car through the trees bothers them, or the flashing strobe lights that are on police cars and school buses and trash trucks, especially in dark mornings, if that perturbs them.
All good advice. Thank you, Mike.
Your comment about certain clinics having more clients that are photic sensitive, I would wonder if those clinics are dealing with a lot of chronic alcoholics or maybe kids on the autistic spectrum where we know there's a lot of perturbations already in the brain or that show up in the EEG.
That would be a good question. Yeah. I'd have to kind of think back to which clinic. It's been quite a few years since.
That and or head injuries too, that would be another one.
Yeah, head injuries, I definitely see. Yeah, I've seen a lot of people with, especially fresh TBIs, they couldn't handle photic. And the other category is clients who have a known history of migraines. That's another sensitive group with photic. I've heard quite a bit of feedback, people trying to do photic on them, and in quite a few of those cases, it does bring on a migraine right in the clinic. So keep that in mind as well.
Another good resource, Aaron, is the talk that Dr. Rusty Turner did on pseudo seizures, and that's in the New Mind YouTube channel. Actually, I referred one of my patients to look at that the other day because her daughter started having certain things occur, which I think is stress induced. She's had problems with the school teacher, and all of a sudden she was having tics and all this. And I said, well, there's a lot of pseudo things that happen with stress and whatever. So for those that aren't sure either, or just further educate yourself, check out Rusty Turner's talk on pseudo seizure activity.
Definitely. And I believe Dr. Suter has a presentation up on our YouTube channel on Photic as well. So if anybody wants to dive deeper into the subject, I would go check out our YouTube channel and listen to Dr. Suter. And I think potentially here in the future, that is a potential workshop that Dr. Suter has been considering doing. So kind of stay tuned for that. Hopefully we can get him to present on it and actually talk a little bit more about all the research behind it, which will tie into kind of when we get into the software here, of all the different options we have for Photic, which I have to say that the way Dr. Suter has designed the Photic in our software is the most advanced I've seen. Most Photic that I've been around has just been consistent feedback, so consistent brightness. Dr. Suter, with all the research he's done over the years, and I think he's spent better part of over 20 years researching Photic, has found there's better methods of delivering Photic. So let's kind of bring that up and let's talk about Photic in the software. So the one great thing I love about the way our Photic is designed is you have access to adjusting the Photic on the fly while your client's training. The company that I came from prior to this, the software was a little bit more archaic in that the Photic software was separate from the training software. So that particular company, they used BioExplorer as the training software, and then there was a custom Photic software that was separate. And just the way the COM ports and all that worked, you couldn't have both softwares open at the same time or you would get a conflict between the two. So I think this is amazing that we can actually adjust these frequencies on the fly. So first of all, the left and the right eye fields that we see here, and we've actually got it labeled, left side, or this is left eye field, is stimulating your right hemisphere. And then here's the right side, or the right visual field stimulating the left hemisphere. Now, the frequencies that are built in, so every time you open up a protocol from 1 to 24, each protocol will have preset Photic already set for you. So you don't have to reinvent the wheel, you don't even have to think about this. But the way these are kind of programmed is we see for the right hemisphere, that's coming over here. So we see our threshold, we're bringing 9 to 11 hertz up here on the right side. So we are sending a 10 hertz frequency in through the left eye field, crossing over to the right hemisphere, and that's right in the middle range here. So we're trying to stimulate that alpha band there. And then for the left hemisphere, we are putting a 17 hertz in through the right eye field. And we can see that's kind of right in the middle range of that 15 to 20. So most of the frequencies you're going to see on the right side, it's generally going to be either 16, 17, or 18 hertz. Now, the rhyme and reason behind this is, Dr. Suter spent a lot of time actually looking at different protocols using Photic and kind of dialed in what he felt and what he saw based off the research he's done of what frequency ideally will be the best for that particular protocol. Now, granted, we're all human beings, we all react a little differently, and that is why I like the fact that we can adjust these on the fly, because the bulk of the people that Dr. Suter saw responded maybe better to 17 hertz for this particular protocol. This is protocol 18 here. Doesn't mean necessarily your client might respond to best at 17. They might respond better at 18, maybe 16 even. So we can try to make adjustments while they train. So in this particular case, 18 we know is one of our true alpha beta asymmetry protocols for generally used with anxiety and depression. So if I was utilizing Photic with a client on this particular protocol, if I'm watching the beta asymmetry down here, and maybe I'm not seeing that much movement, and I've got them set at 17 hertz, I may try them at 18 hertz, and see how that affects everything. Does it make any changes? I can track progress in the trend lines. I can track progress down at the bottom in my asymmetry meters and look to see, is that going from maybe like a 0.97, I change it to maybe 18 hertz and goes to 0.98 or 0.99. Same goes with alpha. And over the years, especially with like protocol 18 and 20, a lot of what I hear from clinics is that generally the beta asymmetry, they see that change rapidly on its own. But they notice that the alpha asymmetry is kind of stuck and they can't get it to change. And I'll make that recommendation of, well, have you tried Photic with them? And they say, no, I haven't been using Photic with them. It's like, well, try that, and set it 10 on the left, and either 17 or 18 on the right, and see how that does. And 80% of the time, I get an email or a call back saying, hallelujah, right out of the gates within, 3 to 5 minutes, the alpha asymmetry improved greatly, and now alpha is back dominant, in the right hemisphere where it should be. And then they just continue to train and reinforce that and keep it there. So the use of Photic along with neurofeedback can be really powerful. Now there are presets here as well. So you'll notice we've got, the general, we've got 4 and 6. We also have a 6.5, so that's in our theta range. This is also one of the frequencies that's in the Zion unit. We use it for sleep. We also have the Schumann frequency. 7.8 hertz. Lovely frequency. 7.8 is amazing. That is also built into our Xeon XL, and it's designed more for deep states training. So that would be alpha theta. So let's say you've got a client in office doing alpha theta, and you notice they're really struggling trying to get a crossover. You can add in the Schumann frequency while you're training on alpha theta to try to help get them to start creating crossovers. And then hopefully over time, their brain kind of sees that happening, and maybe you can back the photic out and their brain will continue to have those crossovers on its own. Same goes if you've got clients doing home training and you're doing alpha theta. And maybe, and photic for these people would be somebody where alpha and theta are close, but they're never quite, making that convergence and that crossover. I wouldn't do this if I had somebody that, had a lot of elevated, especially elevated posterior alpha, and they had mind chatter, so I think we've seen those people try to do alpha theta on them, and they close their eyes and we see the alpha band is up at 20 microvolts and theta is down, running like 6 or 7 microvolts. That's not something that the Schumann frequency is going to help with. That would be somebody you'd want to get on a proportional tones alpha down protocol first and try to chip away at that excessive alpha power, and then bring them back into alpha theta, and then you could incorporate photic at that point with them, and then you have the rest of your standard frequency bands going up to 16 hertz. So if you just wanted to do a straight, so if you used one of these, it's going to put that frequency to both the left and the right hemisphere simultaneously, versus just running a standard protocol. I'm going to have to switch that to an even, and then we can go back to our 10 and 17. Now, beyond adjusting the frequencies, we do notice that we have a brightness here. So it defaults at 9%. That is when we are using the manual setting. So the manual setting is just that. It's going to allow you to manually set the brightness of the glasses to the patient's comfort level. This was about the extent of the photic that I've seen in the past. It's just that manual setting. You can just set the brightness. There's no other fluctuation in it. But Dr. Suter has added in 3 additional options that we can use with our clients. Now, for those of you that have never kind of played around in this entrainment menu, there is this little question mark here, and if you click on it, our amazing developers have given us a little hint here of what each one of these is going to do for us. So again, this manual setting is just the adjustment of the photic parameters are done manually during the training session. None of it's automated by the software. It's all just up to you on kind of where you're setting everything. The next option, which after having a lot of conversations with Dr. Suter on photic, especially when I transferred and came over to NewMind, him and I sat and talked about the photic extensively, just to kind of get me up to speed with what NewMind's doing with it. I was told this proportional is going to be the most powerful photic you can use on your clients. So just like our standard feedback in our software, whether you're doing screen fading or audio fading, that is also proportional. And it was done that way because the research shows us that a proportional style of feedback is going to have the best effects. So with proportional, the way this is going to work, and let's just go ahead, I'll start this up in simulation mode, and we'll get the Photic started here. And I may need, since I've been playing around, I'm just going to need to back out of this real quick and come back in. And then we'll look at it. But proportional, when you're using the proportional setting for the Photic entrainment, the software is going to be controlling the brightness of the glasses for you. And the way that's going to work is when you're doing proportional, as they start, so we can watch that brightness slider there, and we can see that the software is actually adjusting the brightness of the glasses. And how that's working is the Photic brightness is being driven off our thresholds. So as the brain comes closer to threshold and then exceeds it, the glasses are going to get brighter and brighter. Now, to get the glasses as bright as they're going to go, which would be 9% here, they have to get all 4 of the thresholds green and either above or below the threshold, depending on if we're rewarding or inhibiting them. So very similar to if you use tones when you train a client. The only time they're ever going to hear that tone is when all 4 of the thresholds are green. So the glasses are only going to get as bright as they go if they meet all 4 requirements. As they start moving away from threshold, the dimmer the glasses are going to get. So if they have all 4 of them red, it's going to be down at like 1%. They're barely going to see anything. So you're actually getting a whole nother stream of feedback for your client when you're incorporating Photic. So if you were doing, let's say, eyes closed with music, so you've got an audio feedback of the volume changing, and maybe you've got tones in there as well. You can actually do Photic as well, eyes closed. With the eyes open glasses, doing proportional, they should still be able to see the brightness of the glasses through their eyelids. Photosonics does make an eyes closed pair of glasses, if anybody's ever interested. With those, they just bundle all 4 LEDs right in front of where the pupil would be, just to get that Photic penetration a little easier through the eyelid. So with the proportional, we're getting a fluctuation. The next in the list is dichotomous. So dichotomous.
Aaron, excuse me.
Yes.
This sounds a little counterintuitive. As the brain is doing better, you're doing neurofeedback with the Photic, right?
Correct.
But as the brain is doing better, the Photic kind of backs off?
No, just the opposite. As the brain, the better the brain does, the brighter the glasses are going to be. And then when the brain goes back into an unhealthy pattern, then we're taking that brightness away.
Why wouldn't they? Well, however I'm describing my thinking, it would seem that if the brain isn't doing as well, you would want to drive it harder.
That would be a question for Dr. Suter.
Okay, I thought it might be, but
we can have him address that, and maybe when he comes back, he can give us his explanation on why he's got it set that way.
Yeah, I guess the answer will be it's empirically demonstrated, so I'll go with that. But it just seemed a little backwards. That if the brain was not in line, you'd want to, kind of push it more to be in line. But anyway, okay, we'll let him deal with that one.
Yep. So with the dichotomous, we are still adjusting the brightness, but instead of like the proportional, we saw that the brightness was constantly fluctuating depending on what our thresholds were doing. Now we can see this is dichotomous is more like our tones are, where the glasses are going to be off, and then the photic stimulation will only initiate as the training threshold is exceeded. So, in the case of this protocol we're doing now, they would need to get all 4 of these in line before the photic ever even initiated. So similar to a tones, when you're doing that, as well as the rest of their feedback. And then the other option is alternating. So this is shifting the photic back and forth rhythmically from the left to the right eye field in 1-second intervals. So we're stimulating the left hemisphere for a second, and then we're stimulating the right. Protocols like this, we actually, the old company that I worked with, there was a couple functional neurologists that actually utilized this, especially in TBI cases, where they really just wanted to kind of stimulate each hemisphere separately to kind of get them reactivated. For our standard training, I really can't think of a reason, like in that standard case where I would utilize this. If I do photic, I follow the instructions I've got from Dr. Suter, and I use the proportional. One thing I want to do mention about proportional, though, because this has kind of come up in a few conversations, is some of our clients do have a sensitivity to brightness. And I've come across this myself over the years where you barely turn the brightness of the photic glasses up, and you can very quickly exceed a client's threshold. So and that might only be 1 or 2%. Now, if you're doing proportional, it's the software is controlling that. So it's going to be going from 1% to 9%. And for those clients that their eyes are more sensitive, 9% is going to be way too much for them. So if you have a client like that, just simply put them on manual, and then you can adjust the brightness to their level and just kind of hold them there. And there's nothing wrong with that. It's just the way, I've used Photic for the better part of 12 years. It was just with a manual setting. And just that alone, I've seen success in clients. So, you can do that. It's still going to be effective. This would also be the same way our Zion XL unit is set up. And for that matter, any other photic device I've seen out on the market, same thing. They're all just driving generally at one continual brightness that the client would set on their own. So it does work. So don't feel that if you have somebody with very sensitive eyes, that they're not going to get the benefits of Photic. So that's our software. Rob, is there anything you want to add in off your experience? Because I know you've
nothing I would add. I think you've really covered all the bases well, and I've got to run off to a doctor's appointment in 2 minutes. But what I would share with people is, again, the safety cautions you whatever in the beginning. If they tend to have certain histories of things, be careful with that. keeping that brightness, play with the brightness. Some people will handle it, but you got to keep that brightness really low. With their eyes closed, the light goes right through your eyelids, because I did a lot of eyes closed training for anxiety, and sleep issues and pain issues. And I've used Photic with people every single session quite safely and effectively. I don't know how beneficial the binaural beats are. I know Richard's always talked about that's maybe 10% of the training. So the person asking about just using the sound, before you buy another set for a patient to loan out, test drive it in your office for a few sessions and see how that person does it before you do that. And yeah, use it with good fun. If you're doing a customized training, I think you covered that too. Just look at that middle range. You're always training up on either hemisphere, if, right or left hemisphere, whatever you're training up. If you're training 15 to 20 up, then you set your Photic at 17. If you were customizing a protocol, for example, on the right, if you're training up 9 to 11, you set your Photic at 10. Right in between those range that you're training up, and I think you're going to find, if you've not used it, there's tremendous benefit to patients. And it's like I said, without seizure disorder, safe to use. If they're sensitive to light, take that brightness down. I always start it down and I bring it up and ask them is this still comfortable? Instead of starting at the top and freaking them out with like, really bright light. And I thought the example that Michael gave of, driving down the road. When I used to drive in New York, Michael will appreciate this. They have these metal guardrails, and these old, like the Bronx River Parkway and stuff. And it can create like a strobe light effect when you're driving at night. So that's a great way for someone to get a sense of their sensitivity to flashing lights. But, go to a disco as well.
Also,
And other
with
than that, I think that's a lot of great information you've given today, Aaron. And of course, this will be recorded as well. So I'm going to say goodbye to everybody, but great job. Thank you so much.
Thanks, Rob. And I'll just finish up kind of two last thoughts. If you're doing SMR training, 14 hertz both sides works beautiful. And kind of one thing I want to mention is some of your clients, when you use Photic, their brain is an overachiever. And I just actually had a call yesterday on this. Clinic was doing Photic, and they noticed they were actually doing a 2-channel SMR. They were putting 14 hertz in both sides. And what they noticed was that the low beta, or SMR, that 13 to 15 range, was showing up at about 15 microvolts, which is generally just unheard of. So what was happening is they were putting the 14 hertz in, and then the brain was just running crazy with it and overstimulating that. So if you are using Photic and you notice that, the average amplitude of a signal is a lot greater than what it normally is, go over to your spectral display, look at channel 1 and channel 2, and you'll actually see it. You'll see a flare here. So in that case, like SMR, we'd see this 14 hertz bin line just sitting up here, not even moving. It's just going to be static. And there's nothing wrong with that. These still based, off conversations I've had with Dr. Suter in the past when this has come up, like he just confirmed that yes, it does happen. There is no research to support why it happens. We don't know. The one thing we do know is in most of those cases, roughly 3 to 5 sessions in, the brain will stop doing that. So just keep that in mind as well. And there was a question that came up about when would you use 6.5 hertz? Actually, in a clinical setting, personally, I probably wouldn't. 6.5 hertz is generally just going to knock somebody out. That's why most companies who produce AVE devices for home use, they'll have that as their sleep protocol. So 6.5, 6.8 is generally what you're going to see in those. And generally, if you use that on somebody, they're just going to drift off to sleep on you, because you're basically setting the brain up as it would be going to sleep with, you know, as the alpha surges and then starts dropping, you get that surge in theta. That's as we start to fall asleep and start going into that dream state. You know, so in a clinical setting, I really don't see a use for that. That's something we can ask Dr. Suter if he's found any benefits using that in a clinical setting, if it can actually improve anything. So that's a note I can jot down and maybe have him address that on a lunch and learn, or talk about that if he does a workshop on Photic. So, all right, we are at the top of the hour. I know everybody's got clients to get back to, so thanks everybody. We will be back on Friday. I think we're going to be answering some questions on a message that came through on the list server about coherence training. So we'll see everyone back here on Friday. And
Thank you so much, Aaron. Thank you so much. This was very, very useful for all of us.
You're
See
welcome,
you on
Judy.
Friday.
All right, take care, everyone.